Kia ora everyone, welcome back to another Women's Health Action COVID-19 Digi Update. I'm Caitlin, our Digital Media Health Promotion Coordinator, and today I'm joined by Louise, who is the National Social Connections Advisor at Age Concern, and we're going to be chatting about some of the common concerns that were raised in our survey that we did on women aged over 60 living while COVID-19 is around. So do you want to tell us a little bit about yourself, Louise?
Hi, yes, thanks Caitlin. As Caitlin said, I work for Age Concern New Zealand. My role is National Social Connection Advisor, so that involves running our national visiting service, as well as having an overview on the other social connection activities that happen in age concerns around the country. As you can see, like many of us, I'm at home at my dining room table, working as all my colleagues in our bubbles. So hello.
Hey, so I'll just give you a little bit of background on what we found from our survey. So understandably, we found that a lot of people are feeling quite anxious, and we've had over 150 responses from women aged over 60 who are living in New Zealand, and most of those were from people within the 60 to 80 age bracket, and a vast majority were living alone or living just with their partner, and most of them had said that COVID-19 was impacting their current situation quite a lot. And the main reasons that we were seeing were loneliness, not being able to see family, financial stress, adjusting to working from home. And we also saw quite a lot on sleep and anxiety being affected by COVID-19. And we also had a majority of the respondents who were moderately to very concerned that they might become infected with COVID-19. Now, we know the Ministry of Health does have some guidelines for older people during COVID-19, and we'll link to those too. But we thought while we had you here, Louise, it would be really good if we could touch on some of those common things that were coming up in the survey. And I know that you have a lot of great information and techniques, coping advice, services that you can find. I thought a good place to get started was, the main thing that I saw coming up was loneliness. Do you have some things that you could talk about for that?
Yes, absolutely. And first of all, to any of you out there who are living alone or feeling lonely, because we can feel lonely even if we're living with others, look, I can relate. I'm in a bubble of one, so I'm living alone. I'm not quite 60, but I'm not that far off. So, you know, there's a lot of us there. And one thing I would say is if you're feeling lonely, that is a reason to call someone, to let them know how you're feeling and to ask for help. Don't just live with that feeling. Think about who is there in your network, friends, family, neighbours. Please do call Age Concern. Our offices are open. We're all working from home, but our phone numbers are working, and we'll be happy to have a chat and perhaps connect you to someone else for phone support, or if you've got worries or issues about services or other things that are affecting you, then if we don't provide the service ourselves, we can no doubt point you in the right direction. So please do reach out. The other thing is, if you are feeling very lonely and anxious and you're really worried about your health, your mental health, there are formal services that you can contact. There's a government free counselling line. I'll just give you the number, 1737. So that's qualified counsellors who you can talk to free of charge. The advice we're also getting from health professionals is, look, yes, this is a crisis situation, but the hospitals have stopped their elective surgeries and regular clinics. There's currently a lot of capacity in hospitals. GPs are still operating. If you're worried about your health and well-being, please do contact your normal health services. Do ring 111 if you're having an emergency. Do ring your GP if you're unwell. Do phone in for your regular prescriptions, whether that's for anxiety or sleep medication or for just anything to do with your regular health. Your GP is there. They will take your phone call. They may set up a phone appointment for you. In some cases, they are seeing people face to face, but yeah, don't hesitate. Do ask for help. So that's what you can do in terms of sort of formal support. There's also Depression Healthline. So there's a lot of support out there. Do reach out. But also there are lots of things that we can just actually do for ourselves.
Mhm.
In terms of loneliness, I know for myself that one thing that helps me when I'm spending time alone is to just notice the things I do that make me feel happy, that I enjoy, that lift my mood, and do more of them. And I don't know, what would that be for you, Caitlin? What sort of things do you enjoy?
I like going for a walk just nearby my
Yeah,
house, my bubble, listen to music. Yeah,
yeah,
connection
yeah.
if you can.
Well, like, and I think that's a great point too. Uh, we are distancing in terms of physical distance, but we can still go out. And what we're finding is that for older people with limited mobility, that is difficult. I know for me, one of the things that really helps is going for a walk around the neighborhood. And one of the lovely things about this situation I'm finding is how willing people are to chat. I've had chats with neighbors and people walking around the neighborhood that I've never talked to before. Some of them, we seem to be on the same circuit. We go around the same block and I'm meeting the same people, over and over. And, we're now exchanging names and the conversation has gone beyond the weather and COVID-19 and we're having a chat. So, that's really lovely. If you can't get out for a walk, at least step out into your garden if you have one. Go down to the end of your driveway, maybe chat to somebody who's passing by, or at least see people moving about, get some sunshine. Yeah, do look for those things that make you feel better. This is not a time for guilt. If it's binging rubbish on television, that's absolutely fine. If it's reading romance novels, have no shame. Do whatever you like, whatever makes you feel calm, happy, and relaxed. I'm actually crocheting a blanket, very calm, very mindful. I guess if you've ever done a handicraft, this is a great time to do it because anything that we do with our hands, like gardening, cooking, knitting, tends to sort of relax us. It's just a natural kind of feedback loop. I also saw some really sensible advice from Dr. Nigel Latta on TV at the start of all this. And he was just saying, do keep your routine. Just because some of our structure that normally happens in our lives has changed, do get up at your normal time. Don't spend the day in pajamas. Eat regularly. I think particularly if you live alone, it's really important to tell yourself, I deserve to eat well. I deserve to have good food. Take that time, take the trouble, cook yourself something nice, and sit down and eat it mindfully, taste it, smell it, see how it, you experience the food. Same with a cup of tea, just sit there, feel the warmth of the cup, look at how the liquid moves when you blow on it, taste the tea, be in the moment, I guess. So all those sorts of things can help. The other thing I know, there are loads of different breathing exercises you can do. If you're getting that real sense of, I feel very anxious, I'm feeling my heart rate go up, I'm feeling tense. Things that can really help are slowing down your breathing. My favorite exercise, and I did it before coming on this Zoom because I get a bit anxious when I have to do something like this, is breathe in through your nose for 4 counts, hold the breath for 7, breathe out through your mouth for 8. Do that 4 times. And it works in a number of ways. One is that it will naturally slow your breathing, and that in turn will slow your heart rate and will take some of that tension out of your body. But also, quite honestly, by the time you're doing all that counting and thinking about whether you're breathing in through your nose or out through your mouth or what you're doing, you can't remember what you were worrying about. So it's quite helpful. Do you have any things like that you do, Caitlin, or not?
Definitely. I do the breathing as well. I do the try and breathe into my belly slowly and out again, and that helps me. Yeah.
Yes. And it can be as simple as that. If you can't remember that formula, you can just breathe in slowly for 4, breathe out slowly for 4, and keep doing that until you just feel yourself calm down. It's kind of reversing all those physiological signals that we're sending to our body that we're anxious, and it reverses all that physiological process, and it just helps us calm down.
I love that, kind of finding that mindfulness while you're at home,
Yeah.
and yeah, acknowledging that you're still worth cooking a good meal for, even if it is just you. I know I'm guilty of that too. And oh, there's no,
Yeah.
just me eating, you know?
Yes, I mean, toast for dinner is not something to do just because we're in COVID-19. The other thing that can be really helpful, particularly if you're lucky enough to live where there are some trees, some greenery, do step out or look out of your window and notice nature. One of the lovely things that I'm finding very calming at this time is that I live in the suburbs, and there's been a huge increase in bird life. And I only have to sort of step outside my front door or sit on the little bench I've got on my deck and sit there with a cup of tea and listen to the bird song. So I think there are some things about this. It's a difficult situation, but there are some positives. It can, in some ways, feel like a strangely calm time. And I'm noticing with the lack of traffic, first of all, we've got more wildlife, but also I'm noticing other sounds more. If I sit on my deck, I can hear children playing. There's a young man next door to me. I can see his legs through the fence, and I can hear the sound of a cricket ball on a cricket bat. He's obviously practicing his cricket in the garden. So all these are nice sounds, and it reminds us that we may be isolating at home, but actually people are still around us. Good people are still around us. And all those people that we know and love and who care about us, they are still there. I think what can be difficult sometimes, we have some older people amongst our members and the people who use our services who are not connected like this on the internet. I mean, if you're watching this, you no doubt have some internet connection. So connecting people with people in different ways can be useful. And I'm certainly doing video chats with friends in the UK. You can probably hear wasn't born in New Zealand, I'm Welsh. And I've got lots of friends over in the UK, and family. So video calls or just regular telephone calls, different ways to connect if we can't be together with people in person. Um, if you live alone, also do keep a close eye on the government information around isolation. Even at level 4, the Prime Minister has come out and said, and it's there in the guidelines, that if you live alone, there is the possibility of buddying up with another person, perhaps who lives alone or who lives in a very contained bubble. They're really advising older people not to, to stay safe. So if you do expand your bubble, either at level 4 or definitely level 3, think about who else could safely be in your bubble, was the advice we saw yesterday. So for instance, perhaps still better not to mix with anyone who is perhaps a frontline health worker or has children going to school. Think about the number of people who might be in that person's bubble. But if there is another at level 3, it sounds as though we will be given permission to slightly expand our social connection. So think about that. Keep an eye on the advice. Don't just follow my advice here. Look at the advice on the government website. Make sure you understand it fully. And of course, this information will be all over the radio, all over the news as well. So listen and have a think about what might work for you safely in that situation. I heard from Caitlin that there is anxiety about catching COVID-19. And well, let's face it, it's fine to acknowledge to yourself that this is an anxious time. You won't be alone in that feeling of being anxious, in this situation. But the truth of it is that our government has done a very, very good job at minimizing the impact of COVID-19 in New Zealand. And New Zealanders have done a great job, and I believe we'll continue to do that. Community spread is clearly at a very low level, and the government are doing more testing before they make a decision, hopefully on Monday, around whether we come out of level 4. It will be done thoughtfully and carefully, and I think we just need to all continue to follow the guidelines. The other advice that we've had from a health expert, Hamish Jamieson, who I spoke to the other day, was yes, absolutely, to continue to look after your general health. It's important that if you're over 60, 5, you go and get your flu jab now, call your doctor about it, that you do look after your general health, take your normal medication, do contact health services, but also even for older people, the majority of people who get this disease get over it and get better. I guess, yes, it is a risk, and being anxious is quite valid, but don't catastrophize it. Listen to the actual accurate advice. The other clear advice that's coming through from experts around mental health and anxiety is limit your consumption of news. Think about reputable sources. So, for instance, listening to the government briefing each day might be quite a good approach, or just to listen to the 6 o'clock news. But don't spend your whole day consuming COVID-19 information, particularly disreputable information from social media that may not be the best advice. I know for myself, I completely turn off COVID-19 well before bed in terms of sleep. Um, it's really good, as we know, it's good to practice some hygiene in terms of sleep hygiene, not to be looking at screens and absorbing blue light just before bed. So maybe reading a little bit, or perhaps listening to some music before bed is a good thing. I have to admit, I'm a bit naughty with the screens, but what I do before going to bed, because it works for me, is I listen to comedy clips. And I find that if I go to bed on a big belly laugh, basically, I feel very relaxed and happy, and I sleep well after that. But really, it's whatever works for you. Work out, think about yourself, your own sleep pattern, and limit the coffee, maybe limit the screens, have a herbal tea, do something relaxing, and take notice of what works for you. The other thing that can work is just something calming before you go to sleep, which kind of debriefs you. I often write a gratefulness diary. So I think of 3 things in the day that I'm grateful for or that have gone well. And even in difficult times, I've found that there is never a day without something. And it can just shift attention from the negatives, the things we're worrying about, to the positives. And that can be a very useful shift in terms of, where your mind is placing its attention.
Totally. I love that idea, just kind of tuning out before bed so that you don't have
Yeah,
all of the thoughts of COVID circulating and keeping you up.
yeah,
I think there's a wealth of information there, Louise. We've got all of the mindfulness techniques, a little bit of thinking about maybe expanding your bubble, going for a walk, getting out of the house, and also reassuring to know that all of our health services are still operating, so people don't have to feel bad about calling their GP if they are unwell. I think that's good for people to know, because there is some confusion about how the health system is working right now. So that's good to know. And also that you at Age Concern can connect people to services if they're stuck. Is there anything else that you wanted to add? Anything else that's popping up at Age Concern, or any services, any other services that you could recommend to people?
I think so, yes. Yeah, in terms of other services, Student Volunteer Army, we're getting inquiries from older people who are having problems, with the government advice to old people over 70 is don't go out to the grocery store, don't go out and do your own errands. Student Volunteer Army have very efficiently set up a new volunteer service where they're using their student volunteers to pick up groceries and pharmacy prescriptions and things for older people. Have a look. I know if you're watching this, you're online, so have a look at the Student Volunteer Army website. The information is right there on top. There's an 0800 number you can ring, or you can order groceries. You can use the service by filling in their online forms. Really good pop-up service, and we do commend them on that.
A few people were worried that all of the online shopping slots at the supermarket had already been taken up.
Yes, that is an issue.
This could be a good thing to try.
Yes, I mean, the supermarkets have got priority slots for people who've got a Super Gold card, so do use that. Do put your Super Gold card number in, but we're still seeing, yes, people finding that it's a fortnight before they can get a slot. So think about other options as well. The other thing that's coming up as an issue is older people who don't have aren't using online banking and perhaps don't use a credit or debit card are having difficulty paying bills. So the one thing that is arriving in people's homes is the post. So people are receiving the bill, but if their normal way of paying that has been walking down to the post office or going to the bank in person, they're having difficulty doing that. The advice from providers, and this is the electricity companies and the telecommunications companies, is first of all contact your provider, give them a ring if you have received a bill and don't have a way to pay it. Uh, Other options, they will advise you. One of the things they can do is set up direct debit over the phone for you. But if you don't want to have ongoing direct debit, they may advise you, for instance, to contact your bank, who may be able to help you do a one-off transaction.
Oh,
So those are the kinds of things that are coming through in terms of inquiries. But yes, a lot of our inquiries are simply people who are feeling isolated, anxious, worried, and who are doing the right thing, picking up the phone and talking to somebody about that, and seeking some support or reassurance. So please do that. Do call us or call someone else.
that's awesome. That's amazing, Louise. I think this is going to be really helpful for a lot of people. So I want to say a massive thank you for taking the time to share all of that information. It's really great.
Oh, it's been a really great pleasure, and lovely to see you in person, Caitlin.
Yes, thank you so much, Louise.
Take care.